Namaskar, I am Dr. Rajesh Kumar Sharma, Professor and Head of Critical Care Department and Coordinator for Skill and Simulation Lab. In previous module, we were discussing about the assessment part of during the basic lab support. So, in this module, we discuss that after assessment, what are the measures need to be done. So, in the last video, you have seen that how assessment can be done. So, here as we assess that patient is not having any pulse and respiration. If client is not having pulse and respiration, then we immediately have to start the chest compressions. If the client is not having pulse but having respiration, then we have to start the chest compressions only. If the client is having pulse but doesn't have respiration, in that case we have to start only breathing rescue, no chest compressions. So, here we have to follow the CAB method. C stand for the compressions, A stand for the airway, B stand for the breathing. So, chest compressions, then let us see that how we have to initiate the chest compressions. So, we have to go for 30 chest compressions and 2 rescue breathe for the adult, either you are a single or either you are a 2 rescuers. So, in this after recognition the rescuer should ensure that the emergency response system have been activated and begin high quality CPR. So, effective bystander CPR provided immediately after cardiac arrest can double or even sometimes triple someone's chances of survival. So, bystanders who are not trained in CPR are encouraged to provide compression only CPR, also called hands only CPR. So, here when we start the chest compressions, we have to place the heel of one hand in the center of the chest, as you can see in the picture. Place other hand on top, and after that interlock the fingers, and after interlocking the fingers, keep elbow straight, and always remember we have to maintain 90-degree angle with chest and hand. Compress the chest after that, and then we have to see that in the what we have discussed in the previous module, we have to push hard and push fast. It means we have to maintain the rate 120 minutes per 120 beats per minute, and second we have to also see that depth 5 centimeter, and we have to see that equal compression relaxation must be there. So, we have to maintain the rhythm over here. So, when possible change CPR operators every 2 minutes, because sometimes that person who is giving the CPR, he may also tired. So, in that case we have to see that he should be get changed within the 2 minutes. So, because it is important to giving the quality CPR or a high quality CPR to the client. So, now we will see in the video that how we can perform these chest compressions in a high manner. Place the heel on one hand in the center of the chest. Place other hand on the top. Interlock fingers. Keep elbow straight. Maintain 90-degree angle with chest and hand, and then compress the chest. Push hard and fast. Maintain rate 120 compressions per minute. And then we should go for 2 breathing, but here we are practicing only chest compression. Now again we will go for one more cycle of chest compression. While doing, we must count loudly. Okay, now you have seen in the video that how to give the chest compressions. So, and after chest compressions, we have to open the airway, that is chest compression CAB, A airway. So, now we have to see the airway must be open. So, we have to lift jaw and tilt the head, because lifting the jaw will help to make the clear the airway. So, it have to maintain the anatomy of the trachea, and in that case, because if we are lifting the jaw, that tongue will be also get lifted. So, in that case tongue will not obstruct the area or respiratory area. So, that is the reason we have to lift the jaw and open the airway, and after the opening airway we have to give 2 rescue breath to the client. So, the person who is giving that breathe, that this can be given 3 methods. One is through the mouth to mouth, second is can be given by the help of the mask, and third can be given the mask or by the embu. And if the person is put the intubation, and that through the ventilator also we can give that airway. So, this is the method of giving mouth to mouth. You can see in the picture also. Now, here also we have to while giving mouth to mouth, we have to remember some of things in our mind, that pinch the nose first, and after the pinching nose we have to take a normal breath and then place lips over the mouth and blow until the chest raises. So, after take about 1 second and allow chest to fall, and we have to keep repeating for a 2 times it is. So, with 2 breath we have to give, and after then again we have to start the 30 chest compressions. So, this is how we use the face mask. We have to see that notch of the face mask have to be on the top of the this nose, and the wider area have to be the down, where it has to cover whole mouth with the lips actually. So, while giving the blow to the person, that air should not go out, it should go either through the nose or through the mouth to the client, and then we can secure that yes, it is 100% sealed, and now we can give the air to the patient, and we have to see ensure that the chest is getting rises. It's secured. If the chest is getting rises, it says that 100% patient is getting air. And we have to also see that how we have to hold this embu and that face mask. So, we have to maintain the C and E technique. You can see this how we have to with the thumb and when the index finger we have to maintain the C, and by rest of 3 fingers we have to maintain the E technique. C help into the giving the position to the mask, and E helps to the lift the jaw actually. So, this is the how we maintain the airway, and now we will see that how to use the AED. AED is a automatic external defibrillator. External defibrillator or autonomic external defibrillator is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can deliver a shock that can convert a rhythm back to normal. Most sudden cardiac arrests are triggered by abnormal heart rhythm called arrhythmias. A common and treatable arrhythmias cause cardiac arrest is ventricular fibrillation of VF. With VF, the heart's electrical impulses suddenly becomes chaotic and ineffective. Blood flows to the brain and the other vital organs stops abruptly, and the person loses consciousness. So, death usually follows unless a normal heart rhythm and the pulse are restored within a minute. The AEDs use voice prompts, lights and on-screen message to tell the rescuers steps to take. AEDs are simple to operate, allowing lay rescuers and healthcare providers to attempt defibrillation safely. So, here as we attach that the pads to the client, because it is the 2 pads are there. One pad we have to paste on the clavicle side of the right side of the clavicle, and second we have to put to the anterior axillary line between the 5th and 6th intercostal space on the chest in the left side. So, these are the 2, even the locations are already indicated on the both the pads when we will show you in the video that how the AED and how it get function. So, after placing it give the some instructions, and those hearing the instructions we have to in the last it will say that patient requires shock, then it will charge, and after before this giving the shock we have to ensure that nobody touching the patient, and after giving clarification like eye clear, all clear, and after that we have to give the shock to the client. Now, let us see in the video how to handle this AED. Hello, we are here to tell you about the automatic action defibrillator, that is AED. So, you can see here after unboxing the AED, then you will find this AED, and another thing you will find, that is the pad which is getting with the connection. So as we take the AED to the patient, after that as we open it, so first of all we have to make it on. So you can see the on button over here. After making on, it will say apply chest, apply pads to the bare chest of the patient. So after taking these pads, there are two pads. One pad, it is indicating that here you can apply here on the 5 to 6 intercostal space on the entire line of the patient and left side, and another you can see that indications in this pad, it has to be applied on the clavicle side of the right side of the patient chest. Here this all we have to apply, and after that this it will say connect to the AED. So after connecting, it will say analyzing heart rhythm. So after analyzing heart rhythm, it will again say patient require shock or not require shock. If patient require shock, so it will say analyzing or recharge or charging it. After charging, this orange color will again start blinking, and it will say now it has been charged, now you can deliver the shock. So before delivering the shock, we have to ensure that nobody is touching the patient. After making the statement, I clear, you all clear, and after that we have to press this button and it will say shock has been delivered and you can resume the CPR. So once I will show you the demonstration that how actually this machine works. So I am making it on.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Paused. Start CPR.
So you have seen that how this AED works when we take to the patient. I hope you have understood it. Thank you for watching. Okay, now you have seen the AED, that how it get functions in the video. So now there are some important conditions, special conditions before using the automatic external defibrillator in the pregnancy actually, because in pregnancy treating cardiac arrest of someone who is pregnant can come with the heightened anxiety because two lives are at stake. In addition, some rescuer may be unfamiliar with handling this visible anatomy of a pregnant person. The best outcome for both the mother and the baby depends on the BLS rescuers. So it's someone helps, provides high quality CPR and use an AED without any delay. So compressions, ventilation, AED are usually mostly unchanged. It is the same how we do for the adult. And if the abdomen is visible rounded and additional help is available, rescuer should manually displace the rounded abdomen to the mother's left side during compression to help with blood flow to the heart. Another conditions like if any client who is having some medication patch on his chest, so then you remove this medicine patch before pad apply and we can go for the shock. Another condition, if any client is having any implanted devices on the chest, so please do not apply pads directly on implanted devices. Next condition is that if any client is having water on the chest, so wipe it off before attaching the AED pads. So make it dry. Another condition, if the client is having too much hair on the chest, what can be done? So better is that remove the hair before applying pads, because if the chest hair prevents the pads from connecting the skin, so in that case there will be no proper shock for the client and it will be the waste. So if there is any razor, we can save it, or if saving kit is there we can utilize it, or if you have a two set of the pads, so one first you apply, then you suddenly remove that, so some hair can be removed, and second pair you can utilize for giving the shock. There is one change because in this 2020 guidelines of as per the American Heart Association, So, we can utilize the naloxone for opioid management. If you find that if any client is not able to take breath and he have taken lot of medications which really opioid, like sometimes people go for overuse of the opioids. So, in that cases it will delay the muscles response of the chest muscles especially. So, in that case we have to go for naloxone, because naloxone is an antidote for the opioid medications. So, opioid associated emergency for healthcare providers algorithm is there. It is as per the American Heart Association. So, if we suspect somebody is having opioid poisoning, check for the responses, shout for nearby help, activate the emergency response system and get naloxone and AED if available. Is the person is breathing normally? If yes, in that case we have to prevent deterioration, tape the then we have to shout for the in front for the client, open the airway and reposition, consider naloxone, transfer to the hospital, and then ongoing assessment of the responsiveness and breathing. If the client is not breathing normally, in that case, does the response, does the person having a pulse? If having pulse, then support ventilation, open the airway and reposition, provide rescue breathing or a bag mask device and give naloxone. If the client does not have a pulse, in that case, we have to start the CPR, use an AED, consider naloxone, refer to the BLS and cardiac arrest algorithm, and we have to shift the patient to the higher center. So, thank you so much for watching this module, and we will discuss some of things in the video also. Namaskar. Hello, Namaskar. I Dr. Rajesh Kumar Sharma, Professor and Head Department of Critical Care Nursing and Coordinator for Skill and Simulation Center of Swami Rama Himalayan University. So, in this module we are going to discuss about the team dynamics for high performance team during the basic life support. So, as you know that basic life support is a very important procedure and it really need team effort, and without team effort no objective is gained. So, that is why it is most important that every team member of basic life support, they must know their role and responsibilities. So, team members of basic life support, they should be proficient in performing all the skills of basic life support, and they should be clear about the role assignments which have been given to them, and they should prepare to fulfill their roles and responsibilities whatever is given the time of basic life support. They should be well practiced in resuscitation skills which were required during the basic life support, and they should be well knowledgeable about the algorithms which we are doing during the basic life supports, and they also must be committed to the success, because we are committing for the success, not the failureness, because success only means that we have to save the life of a human. So, that's reason we have to commit it for the success. Next is team members role, especially that CPR coach. CPR coach is a most important person who really do major role as a leader also, as a coach also. You have to start, you have to coordinate the start of CPR, that is most important, and here also see that improve the quality of CPR while doing the chest compressions. And he also should state and coach the mid-range target. Mid-range target means if a person who is not up to the mark and is not able to compress chest appropriately, so in that case he should motivate him that he is doing better one, and we should guide him also to give him quality CPR, and he should also minimize the length of a pause during the compressions. So, he should not, because we have to see that pauses should be very less, interruptions should be very less, then only we can reduce the duration of the pause in the chest compressions, and we have to see the better chest compression depth, even though we have to see that for an adult or pediatric or neonate, as per the guidelines that chest is compressed appropriately, like 5 centimeter in adult and 4 centimeter in neonate and pediatrics, and we have to see that improved overall accident CPR. And then we have to see the every team member should know their limitations. As being a team member, you should have your limitations, because we can call for any type of assistance, look for the advices. If you really need some advice, please go for the advice. Do not feel that no, I do not know, need some advice, please. And then allow others to carry out assigned task. If the person, if you are not able to carry your task, maybe due to any reason, please allow others also, other to complete your task, because here task is important rather than personal reasons, because we are saving the human lives, and we always should accept the assistant. As being a team member, we should see that constructive interventions. So, whatever instructions we are doing, whatever care we are giving to the patient or doing any interventions, so that should be constructive rather than destructive. We have to communicate. What to communicate? That is most important over here. We have to communicate. We can share our knowledge. That is most important, because while doing the CPR, if sometime it may happen that you do not know appropriate steps, or maybe some how to compress the chest, or maybe you do not know the rate also. In that case, you can ask frequently to someone, you know what is the rate, we should maintain it. So, in that case, we should share the knowledge. And in the last of the procedures, we have to summarize, and re-evaluating we have to be done, because that is most important while doing the CPR. How to communicate? That is another aspect of it which is very important. We should go for a closed loop communication. Closed loop communication means, like if somebody is giving instruction to someone, then the person should say, Mr. RK, you give injection of dopamine or adrenaline. So, in that case, we are doing closely, we are telling. Closely means that directly we are doing the communication, and now that Mr. RK have the responsibility of telling the person who told to him to give injection, yes sir, I have loaded the injection and now I have going to give it. So, before giving, he have to give the instruction. He would ask to that I am going to give it, and then he said, okay, you go ahead, and after that, again after giving injection, again we have to tell him, yes, I have given 2 ml or maybe 1 gram of adrenaline to the client. So, this is whatever medications or whatever number things we are doing over there on the patient, we have to be tell every time. That is a closed loop communication, and whatever message we are giving, it should be very clear, like give injection IV or IA, how much should be the dose, what should be the medication, and what should be the route. These all things we have to tell very clearly to other team members. So, there should not be any miscommunication, and we have to be the mutual respect, because here we should not shout to anyone and we should not misbehave with anyone. So, we have to be very mutual respective, otherwise because it may create the problem because then in that case the procedure will not be effective. So, that's reason we have to mutually we have to respect each and every one. So, that is about the team dynamics while performing basic lab support for a successful BLS. Namaskar.